Hello everyone, this is Dr. Kirtirani, an eye specialist, a cataract and vitreoretinal surgeon, and a diabetic eye disease specialist. So, in this video series, we are discussing about diabetic eye disease, and today we are going to discuss about diabetic retinopathy. Diabetic retinopathy is a very important cause of decrease in vision or sometimes even blindness in diabetic patients. And today we will understand what is it. So what is a diabetic retinopathy? Diabetic retinopathy is a disease inside the eye which affects your retina of the eyes. Now what is the retina? Retina is a transparent structure which is present in the back part of your eyes, which we are not able to see from outside our eyes, and it is seen only by your eye specialist with the help of some instrument after dilating your pupils, which you have noticed whenever you visit to your eye specialist. They dilate your pupil and see your eyes with some instrument. At that time they are visualizing your retina only. So in diabetic retinopathy, retina of your eyes is affected. And exactly what happens inside retina is that in diabetes, the small vessels of the retina are affected, and these vessels, because of uncontrolled blood sugar levels and because of the metabolic changes and other oxidative stress because of diabetes, these vessels tend to leak and they don't have the normal capacity to hold the blood, as a result of which the fluid from these vessels start leaking. And as the fluid leaks from them, and if this fluid get collected into the center part of your retina, that is known as fovea, then you start experiencing decrease in vision, which depend upon the amount of fluid which get collected in the fovea. If it is little fluid only, then you will experience a decrease in vision by 2 to 3 lines. If there is massive collection of fluid, then you will experience more decrease in vision, and sometime you can read only bold letter from a far distance. There is such a decrease in vision. So this is responsible for decrease in vision, which is usually seen in early stages of diabetic retinopathy. And ultimately what happens as the disease progresses, these small vessels which are leaking till now, they get to occlude, and when they get occluded, then they are not able to supply oxygen and other nutrients to the retina, because of which the some part of retina start dying as they are not receiving their normal blood supply. So they lack oxygen, lack nutrients, hence they start to crave for oxygen. Because of this, to compensate for this craving, ultimately what happens inside the eye is that release of some factors which ultimately start developing new vessels, and ultimately some new vessels develop to compensate for decrease in the oxygen. But these new vessels are not the normal vessels. They are like a ticking bomb which can rupture anytime. And if this vessels ruptures, ultimately what happens, that whole of the eye get filled with blood and you are not able to see anything from that eye. So ultimately your vision decrease, and after some time, some days or weeks, and sometime even in the coming few months, it take months, this blood filled inside the eye start to get absorbed in your body. But after some time again some other vessels will rupture and again blood will fill inside your eye. Sometime this blood get partially absorbed, sometime fully, and this ultimately cycle goes on. The multiple time bleeding happen inside your eyes, and ultimately your vision is affected severely by this cycle. And if it doesn't clear on its own, then it sometimes require even massive surgery, which is sometime even 1 hour 2 hour surgery to clear this blood. So ultimately this affect your vision, and in the last stage of the disease, if it progresses even further, then what happens, ultimately these new vessels start to develop even in the front part of your eyes, which we see from outside as a black part. These new vessels start developing on this black part, which is known as iris. And ultimately the fluid channel which is draining the fluid inside our eyes to the outside collecting channels, they get blocked and pressure start developing inside the eye, which ultimately result in a condition which is known as neovascular glaucoma, which ultimately result in a very painful condition. So at this stage the patient have a very painful blind eye, which require extensive treatment, and sometimes even after the best of treatment the vision is usually not recovered in this case. So these are the changes which we have discussed today happens in a patient with diabetic retinopathy. In coming videos we will discuss what are the symptoms, how can you identify these condition in its initial stage only, so that you don't land up in this stage, how you can prevent this, how you can identify this at early stage, and how you can manage these conditions if all these things happens. So stay tuned for further videos. Till then, take your precious eyes.